into a time of questions and answers now. We've finished with our presentations, and we have maybe about 10 minutes if our panelists are available for various questions. One question that's come in is what can you say about the hard cases where people claim their autonomy is being disrespected if we do not legislate for assisted dying and assisted suicide and euthanasia? Nice, easy one to start with. Sorry about that.
I think I can speak to that.
Sarah,
I mean, yeah. I think that, you know, there are hard cases. I think we've heard a lot about the fear that patients living with life-limiting illnesses have about being a burden. But I think one of the things that is driving this debate is the fear of people that they will die with pain. And I think that's really overestimated in people's minds. I think there will be hard cases, but hard cases don't make for good laws, they make for bad laws. We need to protect the entire society and protect the most vulnerable in our society. And legislating for the wishes of a few individuals is not a reason to put the rest of society and vulnerable members of society at risk.
It's interesting you say the thing of the overestimation of pain, Sarah, because I actually I took a call from someone at the radio station this week, and she said she was in favor of legislation for euthanasia, but she mentioned that her mother had died when she was young, and while she didn't have a lot of memory, she remembered that she suffered. And she said that she had children herself and grandchildren on the way. She loved life, but she had told them that she favored the idea of euthanasia. What would you say to her? You know, are there things? I'd say that I did talk to her, and probably I would say that there were some things that she hadn't thought through. But what would you say to her?
I think this is why we need to have a broader national conversation about death and dying. I think people really overestimate the likelihood that they will suffer physically towards the end of life, and palliative medicine and pain management have moved on hugely. You know, there's so many of our patients who have witnessed people suffer 30 years ago or 20 years ago, and we just have a lot, you know, more options now, a lot more expertise, and there's lots and lots of evidence to show that the number of people who have uncontrolled pain or physical symptoms at the end of life is very, very small. I think that there's a real fear around death and dying. And I think one of the things that in our day-to-day practice, Faith and Miriam might agree, you know, I spend a huge amount of time allaying people's fears, talking them through what dying is like, that it's a gentle process, it's not traumatic, you know, because people don't have that experience of death. Death used to be in people's houses. It's now moved into the hospitals and, you know, other institutions. So I think that by having a broader debate around death and dying, I think a lot of people's fears can be allayed. But I think that's,
Well, here's a question well, I'd love to get an answer from all three of you doctors, but it's a question which I think is helpful. Without breaching patient confidentiality, could the panel give some more really specific practical examples of palliative care in action, since most of us only have a vague idea of what it is?
Well, I think Sarah has already spoken to the idea that people die peacefully. By and large, what we see every day is people very peacefully dying, but with lots of sadness around, because it is sad. There is a loss, and there's no getting rid of that sadness, but we need to support people through it. So family are often left with a feeling of sadness, but it's not painful. So that's the first thing to say. But the second thing, specific example that you asked for, in very recent times, I met a person who was in severe pain, had a new diagnosis of a cancer, very similar to your radio listener, who as a child had witnessed the death of a parent and had traumatic memories from it, found it difficult to talk about. And when I met him, the person wasn't able to sleep because they did have quite severe pain. And I suppose learning how to manage pain is something that we would promote, but that we can do. And with very simple measures over just a short number of days, using morphine, which again, people are afraid of, but it's excellent for managing pain. He shifted. So he shifted from a person who said, yes, if you gave me those pills now, I would take them. I want to protect my family from experiencing what happened to me. Within a very short number of days, that was gone. And he said, no, I wouldn't take them today. No, I'm feeling much better.
Yeah. So
in Canada, where this is legal, I get phone calls all the time from family members and people who are then, so let's say a husband is considering euthanasia and the wife is all concerned about this. And what we're finding most often that people have fear. So they're dealing with a natural human reality, and that is fear. So that we see this also in the data out of the Netherlands and Oregon, etc. But data can only go for so far. But when you're talking to people, they're talking about the fear, their fear of the possible future suffering, the fear of what may come. And they're thinking that they want to escape that fear. But there's also this second level that's occurring with a lot of people, and they call and they're dealing with this feeling of abandonment and loneliness. So you have the combination of this fear, which is a normal human reality. We all experience fear. And then there's also this other side of things where a lot of people are, going through these conditions alone. They might not be in pain or whatever, but they are alone and lonely and feeling like, what is my hope, right? They have this feeling of a loss of hope. So really what euthanasia is then dealing with in this whole situation is people are then responding to their fear and their loss of hope and their loneliness and their abandonment, and it's a bad mixture because we're not actually then bringing people a good death by lethal injection at all. What we're doing is we're ending a life, yes, but we're not ending a life in a hopeful situation. We're not trying to bring families together and have a nice true death with dignity, as we would say.
A question again for the doctors is just like I have a daughter who hopes to be a doctor, and there's so many other young people who aspire to enter the medical profession. Can you talk a bit about how something like this could affect your profession in terms of its culture?
Well, I suppose I wish your daughter all the best. In medicine, it's a wonderful profession to work in, to be able to help people. So I do hope it all goes very well for her and she enjoys it. But I suppose a core issue for us as doctors, as nurses, as healthcare workers, is that we're there to help the patient, and the patient actually needs to know that we're 100% there for them. Legalizing assisted suicide and euthanasia changes the healthcare worker-patient relationship entirely, because there's always that it changes the power dynamic. Unfortunately, that's a kind of an unacknowledged or maybe an under-acknowledged issue in this. When we see a patient as doctors, the patient needs to know that we're focused completely on their care and individualizing the best care option for them, while legalizing assisted suicide and euthanasia undermines that. It actually brings another issue at play, issue at play, and actually it underestimates what's been coming through a lot. And I see Alex nodding, so I'm sure he can discuss it better. Is that it's actually about fear of the unknown, uncertainty, fear of different. But actually, we can talk through that, or much more important, it's important to listen to patients voice their concerns. And we know that people can change their minds over a long period of time, as the Tilda study has shown, as Baroness Finlay discussed, and as Alex eloquently discussed as well. And people are complex. We're all complex. We are feelings change. There's logic, but our practice is influenced by logic with feelings. And like Faith said earlier about the environment, the culture that we're in influences what happens so strongly. So this would have an enormous impact on the doctor-patient relationship. And we need to know as patients, I mean, we all will be a patient at some stage or have been a patient. important. And what I'm hearing this morning is a broad coalition. We're here as and Connor, I want to thank Connor and Kathleen and Elma so much for sharing what it's like, what the lived experience it's like. We're here as doctors, and for Joan kindly sharing the experience from Pieta, and for advocating for persons who have mental health challenges. And we're all concerned about the impact of this bill. And Alex and Professor Finlay have kindly explained the international perspective, and we're all saying the same thing. We are worried about how unsafe this bill is and the risks to patients and to families, because what happens to patient affects the family too, and the loved ones too, about legalizing assisted suicide and euthanasia. It's just such an enormous societal shift that an awful lot of discussion and thought needs to go into it.
Thank you, Miriam. Now, I just have I have a question that I'm going to put to, I suppose, our three, I suppose, advocates, we'd say, Joan, Elma and Connor, you know, with your work for disability rights and mental health rights. A question that was put to Elma, but I'm going to put it to all three of you, but I'm going to put it to you that you are, you're in an elevator with a politician. Forget about COVID for a minute and social distancing, but you have just a short journey up a few floors to talk to them about why you think this bill and introduction of assisted suicide is a bad idea. What would you say to him or her? Maybe Elma, you can kick off.
I'd probably press the stop button first anyway. Have a good time. But yeah, you'd have to go through everything with him and just say that the people's worries and fears, you know, as they were said earlier on there, your worries and fears today won't be the same as they will be in a week's time. You know, you have to take into account and it's a broader range as well. Like, you know, your pain might be as big as somebody else's pain or something like that going forward. That you know, assisted suicide really is what it is, and you have to call it what it is. It isn't a dying with dignity. There's no dignity in the bill at the moment, and I don't think there could ever be a dignity in dying with assisted suicide. It's there. I don't know if anybody else wants to come in there and say something about it, but I know for Donald that he lived with cancer. He was totally aware of what he was going through. He wasn't under any illusion of where he was going, or any delusion either of where he was going. The palliative care team took not only care of him, but they took care of us as a family too, and they helped us so much so that that we knew we did all that we could for Donald, and that helped us in our grieving process after as well. That knowing that we had no regrets of what we did, everything for Donald after. And I think that's huge, because you have to live with the consequences of what you've done. And if you help somebody to die, you're going to live with those consequences as well.
And in that case, it was a testament to the whole nation came along with you, you know, in that journey. Joan, what would you say?
Well, as a former senator,
you've been in those corridors. Yes.
I was in the lift with politicians, but what I would say to them is be brave. Stand up for what you believe in. Stop looking for the populist vote, and truly, truly listen to the argument here that this bill is going to cause havoc, absolute havoc. It's going to ruin our appreciation of preciousness of life and humanity. So I would say to that politician, for God's sake, for once, stand up on your own and be counted.
Thanks, Joan. How about Connor? We're going to give you the last word. If you had this opportunity, what would you say to our politicians?
I would say that for those that are questioning that euthanasia is a bad idea, I can only speak from my experience and say that I'm informed by my faith when I say that my life was not created by me. My life, my parents contributed to giving me life, and therefore when other people give me my life, I don't have the authority to take away my life. I don't have the authority to do assisted suicide or euthanasia or anything like that. And just to echo what Gunnar was said in that video, if I took away my life, my parents' world would be torn upside down, and my parents have worked so hard for me to get me where I am right now, and if I opted for euthanasia, that would be a poor way to repay my parents' love for me. And I would urge the politicians to consider that when they're debating the euthanasia bill.
Thank you.
Can I just add one thing there? What Alex said there earlier with the figures going in Canada and American places, it reminded me of Ireland in the 1950s and 60s, when you know, somebody could be put into a psychiatric hospital, nothing wrong with them, maybe just a slight disability, or sometimes just maybe the younger person in a farm, a family farm, if they wanted to get rid of somebody like that, and they were signed into psychiatric wards and psychiatric units by a local doctor or a brother or sister or something like that. So really, we're going way backwards. Like, we're going backwards with this back to the 1950s and 60s.
Wow. So thank you all for being available to respond to questions. This actually brings us to the end of our conference. Thank you for attending End of Life Matters, a conference of Hope Ireland. I hope you found it informative on this such an important issue. My thanks to all our contributors: Conor Lynott, Baroness Laura Finlay, Dr. Miriam Colleran, Dr. Faith Cranfield, Dr. Sarah McLean, Kathleen Rogers, Elma Walsh, Alex Schadenberg, and Joan Freeman. Also, thanks to everyone who submitted questions. Hope Ireland are going to be going through those questions and responding to them by adding to the FAQs, the frequently asked questions, on the website.